Thank you very much, Danielle, and thank you for our panelists today. And now I would like to ask Mr. Jean van Vetter, the Managing Director of Enable, to give his final remarks on the discussion.
Thank you very much. I know it's a Friday afternoon, so I will try to be very short. First of all, thank you very much. It's a great honor to be here and to close this very important seminar. I would like to thank Charlotte. I don't know where she's in the room. Charlotte is a student who worked with us at Enable and proposed me to come here today. And I was very pleased. And I was very pleased to hear the debate right now. And I was asked to give a few remarks based on what I heard. One of the things I heard is jack of all trades, and I was very happy to hear that because this is the way I feel. I'm a jack of all trades. I studied business engineering, so I'm not a medical doctor, and I worked for a few years as a management consultant for Deloitte before deciding to follow my wife and to work for Handicap International in Cambodia. Handicap International is working with people with disabilities, a field which I didn't know at all. And to be honest, when I decided to go to Phnom Penh, I didn't know where it was on the map. And I arrived in Cambodia and I was asked to manage a road safety program. At the time, road traffic injuries were increasing. It was in 2003. Cambodia was still very much known for landmines and HIV/AIDS and other public health issues. And we were seeing, looking at hospital data, that there was an increasing number of patients at the hospital being there because of road traffic injury. But it was not recognized as a public health issue at all by the government, but also by the international donor community. And it's where actually when I hear the topic about today, that I was thinking and I was looking at my past and trying to reflect on that. And this is transversality. Basically, you were transdisciplinarity, sorry. You had a country having a lot of public health issues, but one of them was growing and nobody was seeing it. Nobody was prepared for it. And even worse, the donor community, because at the time Cambodia was still very much dependent on foreign aid. I remember going to WHO, going to UNICEF, going to large donors. Nobody wanted to hear about road traffic injuries and road traffic victims. And it's only when we started to do we asked the American CDC to help us to do some kind of epidemiology analysis that we showed that actually the number was so high, much higher in terms of ratio than the landmine victims or than HIV/AIDS patients, and that it was a huge public health issue with a huge burden on the health and the economy of the country, that we managed to get attention on that. Another reflection, later on, I worked in China for Handicap International as well. And we were trying to promote the function of a physiotherapy. China was a country which was very much medical in its approach to public health. You had a lot of doctors, surgeons, but all the paramedical fields were not very developed. And we had difficulties to explain that physiotherapy was something needed for patients after an accident. There was not a recognized profession. It was not something that young people wanted to do. They wanted to be medical doctors, but they didn't want to be a it didn't exist actually in Chinese, even the word physiotherapist. And then in 2008, you are young here in the room, so you might not remember, but 2008, there was a huge earthquake in China, the Sichuan earthquake that killed more than 90,000 people and injured more than 300,000 people. And I was by chance, not by chance, I cannot say that, but I was at the place of the earthquake when it happened, and I said, we need to do something. And although it was a disaster, we felt it was an opportunity to promote what it is to be a physiotherapist, because most of the victims after surgery, they needed long-term physiotherapy. And I can tell you I'm very proud of that. Something I'm the proudest in my career is that we developed all the protocols for physiotherapy during that period, and they became official Chinese protocols still used now. And as a little NGO, Handicap International, it can show you the impact you can have if you apply a transdisciplinary approach and you try to think outside of the box, but you can really change the thing. Then a third reflection, it's more on what I do. I don't know if you know Enable, what I do know. I mean, Enable is the Belgian development agency. We are not very well known. We were used to be known the Belgian Technical Corporation. We work in 20 countries, mostly in Africa. And 2 years ago, we decided to revise our strategy. Our strategy was very much structured based on disciplines: health, education, infrastructure, governance, agriculture, so very much disciplines, and we had teams, or technical expertise team were structured that way. We had a big health team with medical doctors. We had, so yeah, I heard that Dr. Van Bell was one of them. I didn't realize you work for Enable, actually, that's what you said, right? I didn't realize. But we had teams were organized by department, and there were a lot of silos, and it's something that I think it has been addressed as well. People working, being specialists and working in their own discipline in silos. And it was the issue I faced, and it's still an issue, I have to tell you. But we decided to review our strategy and to change it from working based on according to disciplines, but we decided to work around global challenges. And we selected 5 of them: peace and security, climate change, economic and social inequalities, including access to health there and access to education, migration, and urbanization. The 5 disciplines are interlinked, and they are all linked to demography. The fact that there will be 3 billion people on the African continent in the coming years, huge impact on urbanization, huge impact on climate change, migration, and all the others I mentioned. But by working around global challenges, for each of those challenges, the type of solutions we bring to our partners in Africa, they are transdisciplinary. So when we look at climate change, we don't only look at technology, or we don't look at adaptation, we look at agriculture, we look at the impact of climate change on health, we look at the impact of climate change on migrations, we look on the impact of urbanization and climate change, impact of climate change on urbanization. We really look at how those challenges are interlinked. It creates a lot of discussion, very interesting discussions within Enable, but it also obliges the people specialized in specific disciplines to work together and to get outside of their specialist bubble and to not to become generalists. I heard the debate between generalists and specialists. They can keep their specialty, but they need to be much more open, I heard humble, to the disciplines of the others. And that's what we try to encourage now. It's difficult, I can tell you. It's not. It doesn't happen like that. And a fourth remark I wanted to do from what I heard: vaccines. You mentioned vaccines inequality, and thank you for mentioning it. It's something we are working on, and it's also typically an issue of transdisciplinary approach. And what we are trying to do is to transfer know-how and to have local productions of vaccines in Africa. We selected 2 countries, Senegal and Rwanda, but it obliges us to change completely the way we do things at Enable. Before, we were selecting a partner country and we were assisting this partner country in improving access to health, access to education, as I mentioned. But vaccine production, something totally different. We need the private sector, obviously. We need the pharmaceutical industry to be on board. We need to work on patents. We need to ensure it's not only, let's say, if you work on patent and you have private sector investment, you need a regulatory framework in the country, you need a local medicine agency, you need to have distribution networks, you need the population, the local population to accept vaccines. So it's a work that we cannot do alone, and we need to involve all type of disciplines, all type of factors. And I come to the last point, which I wanted to say today. I heard Enable, and I was very pleased to hear that because that's our name, but Enable with the B-L-E, not B-E-L. But that's the way we consider ourselves, as an enabler. We are a broker of expertise. We have our own expertise, but we are also using the expertise of our partners. We work, for example, with MEMISA and other partners, with the KUL. I think we have agreements with the 5 Flemish universities who are here today. I hope, at least. I'm sure Antwerp, KUL, Ghent, which one I forget? Yeah, I'm sure we will argue VUB as well. And so, yeah, that's why I was pleased to be invited here, because we need you, and we have to work together to make sure that our planet is better. Thank you very much for inviting me. Have a great weekend.
Thank you very much for these important reflections. Slowly coming to the end of this seminar, I think I can say in all of our names how much an amazing experience it has been to listen to all these important insights from all of our speakers and the students. I think it has been clear after today how important it is that global health has an effective cooperation within the different fields, and how important it is to have a transdisciplinary view in practice as well. At the end of this seminar, I would like to express our gratitude to everyone that helped us to organize and carry out this first student seminar. Only 6 months ago, in the middle of the COVID-19 pandemic, the idea arose among some of us students to organize a real-life event to show what we have worked on during this master's program. And quickly, a very enthusiastic and effective group of students formed this group. Yes, and to showcase not only our student work, but to invite all the speakers that we have met today. Thank you very much for coming. And I would also like to thank our audience to be so active and contribute to this event today. We would like to thank Professor Olivier Derome and his whole team and the whole faculty to being so supportive with our project, and their full support from the very beginning. We would also like to thank Professor Debarati Guha Sapir for her very inspiring keynote speech, and all the panelists who were here today, Dr. Alice van Belle, Kashi Karaso, and Commander Sergeant Kurt Engelen, for enriching this seminar with their valuable insights. We would also like to thank our student presenter, Fiorella Ferje de la Torre. We would also like to express our gratitude for all the students who have prepared for today through their poster presentations or a virtual video. Special thanks to all those global health professionals, Miriam Kittir, Professor Marlene Temmerman, and Dr. Gundo Aurel Weiler, who prepared videos for today, and Mr. Jean van Vetter for his presence and reflections. And of course, to you, our wonderful audience today, thank you for your interest and your very active involvement in this event. We hope that you enjoyed the seminar. And if you have any additional questions, feel free to contact us at the website, and we will try to answer all your questions as soon as possible. We would also love to hear your reflections. Yeah, and coming to the end of this seminar, we would like to draw your attention that next year we would also like to organize a second edition for this event. Yeah, and now enjoy the reception, and we hope for a little more informal get together. And I would like to ask our volunteers to come here to make a picture together. Thank you.